As I hear. Welcome to Brain Health Tuesdays. Brain Health Tuesdays is a collaboration between AARP Massachusetts and the Alzheimer's Association to provide tips on how to incorporate the association's new 10 healthy habits for brain health into your everyday life. Hello, everyone. We have people from all over the country joining us. So please put in chat where you are from. I'm Sam Doctovitz, a volunteer with the AARP Massachusetts Speakers Bureau. AARP maintains a deep focus on the health, financial security, and personal fulfillment of people 50 and over and their families. You'll find that focus reflected in our offerings, resources, and in our advocacy. AARP just wrapped up a month-long series for caregivers in May. I had the pleasure of doing two of the webinars, one on the AARP 6 Pillars of Brain Health and another on downsizing and decluttering. You can find the recordings and all of our other past events at the AARP Massachusetts YouTube page. Please become a subscriber so you don't miss a thing. To keep up with all we are working on and offering, you can go to aarp.org/local wherever you are in the country. Do check out the AARP Brain Health Resource Center at aarp.org/brainhealth, one word, where we offer lots of tips, tools, and brain health information. Today's topic is movement to support your brain and body, presented by Jazmin Averbuck. With an MS in health and physical activity from the University of Pittsburgh, Jazmin has spent the majority of her time working with special populations, including seniors, on physical assessment, functional movement, and easing into movement after injury or time away. In addition to being a competitive strength athlete herself, participating in Highland Games and strongman competitions, Jazmin also owns a warehouse gym and focuses programming on skills clinics and bringing special populations into the gym setting. As a development manager for the Vermont chapter of the Alzheimer's Association, Jazmin has helped foster relationships with Vermont-based recreational opportunities for aging populations, including those living with dementia and their care partners. This includes teaching a senior strength and functional mobility class twice a week at the local recreation center. Take it away, Jazmin. I know everyone's really interested in hearing what you have to say on this great topic.
Thank you so much, Sam. And thank you everyone for joining today. As Sam said, my name is Jazmin Averbuck. I am a staff partner here at the Vermont chapter of the Alzheimer's Association. I work with so many of our development activities, including walks, the longest day, and our gala. But today I'm really excited to be able to talk to you about how movement can help you maintaining your brain health. So, as we're going through today, I may ask for participation. I may ask questions, and I'd love for you to answer any of those questions I have in the chat. My colleague Norma Milligan is going to be looking at the questions that you may have for me. Please do reach out, ask questions. I love to answer the things that you're wondering about, and that's what really today is going to be about. I love seeing that people are chiming in from all over the country. This is so exciting. I'm up in Vermont. It is beautiful and sunny, and I love getting into the outdoors. So, we're going to talk a little bit about getting out, having movement, being everywhere you can possibly be, and just moving as much as possible. So, the first thing I want to talk about is why we want to do movement. I'm just going to talk about that briefly. As I'm discussing why we want movement, I'd love to hear from you in the chat about what type of movement or exercise you're currently doing, if any at all. But the reason that we do movement, so case studies in the last few years have told us that getting 15 minutes of movement daily is better than getting 40 to 60 minutes of movement 2 to 3 times a week. So a lot of the times we think about movement being, I have to go to a class, I have to take an hour of my time and go dedicate that straight to movement or exercise. But really, we're finding that just 15 minutes of strenuous, and we'll talk about that a little bit in a second, movement and exercise every day is almost better. Okay. they're finding also that it used to be we would exercise to help the comorbidities to Alzheimer's and dementia. So helping with weight loss, helping with diabetes, helping with blood pressure, low cholesterol, lowering our cholesterol, those kinds of things, all those comorbidities. They're finding now that strength training and exercise have a direct correlation to helping us maintain our brain health. So it's not just focusing on those comorbidities, but also just focusing straight in with our brains and what our brains are doing on their own. So that's why talking about strength specifically is one of my areas of expertise. We do a class 2 times a week right now with about, usually have between 11 and 19 seniors with me, and we do functional strength movements that are with small hand weights. We get on the floor and use our mats and use our body for movement. We do altered exercises. So instead of a full squat, because a lot of our joints aren't working necessarily the same and our balance is a little off, we do chair standing from a chair and sitting back down to that chair. So we'll talk a little bit more about that. Just as I want to get back to that strenuous exercise. So some of us may have uh, wrist watches that tell us what our heart rate is. Our doctors may have told us that you want to have your heart rate between a certain numbers. Listen to your doctors when they're saying those things. I am not a doctor for that. But what I call strenuous exercise and what we usually use is, if you would have a conversation with somebody while you are working out or while you're moving, it should be a little difficult to string all those words in the sentence together without having to take a breath, without having to like pause for a moment. You want to make sure that you're getting your heart rate up enough if it is healthy to do so, and if it's safe to do so, so that you would have a little bit of a disconnected conversation. Not that you're panting and not able to catch your breath, but that it's a little bit difficult to converse with the person next to you. So that's how we use that strenuous exercise, or that heart rate levels. That for some people could be a heart rate of 110 or 90. That for some people could be a heart rate of 140 or more. So it all depends on your personal fitness level in that. So that's why we don't necessarily use the numbers to talk about that. So I'm going to look here in our chat and see what people are doing currently. So it's looking like a lot of people swim and do yoga, which is great for your joints. It's a little bit stretching movement. That's awesome. Walking is fantastic. Just keeping in mind, making sure you have that great heart rate going, or what your strenuous exercise is.
Jasmine, there is a question in the chat.
Yeah, of course.
She's been doing aqua aerobic exercises, and she's asking what exercises are best for strength in the legs and balance.
Yeah. Okay. So aqua aerobics or exercises are fantastic. So something that you can do, I don't have a specialty in aqua exercise, but something you can do on land to help with that balance is holding onto a chair and going up on your toes. So doing calf raises, being holding onto the back of that chair as well, and spreading your feet out so they're a little bit wider than hip distance. So they're out here, going up on your toes so your heels are raised, and then squatting down will help with that, the inner legs as well as the outer legs at the same time. So you're helping to build that core strength up. The other thing I really enjoy doing with some of the people in my group that I work with for their balance is I have done 2 separate activities with them. I've had them do side leg swings. So you're pointing your toe and you're squeezing your butt. You want to make sure you're squeezing your butt and bringing your leg out to the side as straight leg. So you want to make sure that you're engaging your entire, all around your hips. And we're strengthening the muscles around our hip joints and it keeps us upright for the most part with those. The other thing is I like to do is lay on the ground on our bellies and with our hands out in front of us, just like this, and our feet, legs stretched out behind us, squeezing our butt and bringing our legs up straight, as well as our upper body up straight at the same time. It's a very, very small movement, but it really affects our entire core. So our core comes from about here, below our sternum, down to our knees is what we consider our core. So it's not just our ab muscles or just our back. It's our lower back. It is our abs. It is our glutes or our butt. It's our hips. It's our quads. It's our hamstrings, and keeping all of those engaged and strong will help us stay balanced. And then those are also some of the things that you might be doing in the pool as well, and using the resistance of the water to help you do those strengthening motions. The only one you really can't do is that canoe stretch. I would not suggest doing that in a pool. Awesome. Yoga and Pilates is great. When we're doing yoga and Pilates, are you doing that in a class, or are you doing that on your own at home? Just as a question. For the question, is it okay for osteoporosis sufferers? I would say yes, to an extent. You want to make sure that you're talking to your doctor or talking to your PT or OT about your physical therapist or your occupational therapist, any of those, to make sure that you're not going above or beyond what you're able to do. So if you're feeling fatigue, it's not pain, but discomfort is often okay, because that means that your muscles are growing and they're strengthening. But if it's acute pain, like it feels like something is wrong, stop doing that exercise. And that's for everyone. Stop doing that exercise, and check in with someone to see what you can change. So sometimes it's just changing the angle that your joint or your movement is going in. But it could also be something that's going on with your bones. So like not doing a lot of weight possibly, but doing more body weight motions, not going in a squat, not going below 90 degrees, but just going to that 90 degrees in a chair. So not going to a lower chair, but a higher chair. It'll still do those same motions. It'll still feel good and strengthen those muscles, but it'll be within your range. So you always want to check what that range is for you. Awesome. I love that we're doing this in class. Classes are great because the instructor is there to help you along the way, give you instruction. You don't have to think about what you're necessarily going to do next. They're there to do that for you. They're also able to help you with any of that form stuff. So if you're feeling pain in an overhead press, so you have your weights and we're out here and we're pressing up like this to help with our shoulders, and that hurts a little bit, then you can maybe change it to being here, and pressing this way hurts less than coming out to here. So it's your instructor would be able to help you with those angles. So I like that somebody brought up like your insurance company cutting you off for PT. That is difficult. The things that you learned with your PT during that time, a lot of it, you may be able to get notes from them, although you're not able to pay them to necessarily work with you. You could possibly get those notes and try to incorporate a lot of those things that they worked with you on. But it is your insurance company will possibly give you options to do PT There's also different programs through insurances and other programs, like Silver Sneakers or any of those kinds of things to help you get into classes or go to a gym to be able to work with um, a trainer or use different equipment that you might not have at home. So, um, I love that we're all moving. It seems that a lot of us are moving. We're getting in the outdoors. Some of us, it's a little hot to get outdoors, which is always when a nice pool is helpful. When we are in warm climates, and we were just talking about this before now, getting the movement that you're doing now, if you're in air conditioning, you could feel a little bit more stiff. So getting into a warmer space, making sure that you are stretching and warming up your body and your muscles as much as possible so that you can make sure you can get um, that full movement. You are not straining your muscles, overstraining your muscles that are cold. You're making sure that you're able to move freely and that the temperature of your body and the temperature of your muscles is not what's hindering you, and you're able to get what you're able to from everything. So that's really important too. So some of us that I have a warehouse gym that we work out in, and it is not air conditioned. So I have clients that come in, they're like, oh, it's so warm. And yes, we want to sweat. And as long as you're able to breathe properly in the warm, that could be really good for your body. The class that I teach seniors in is very air conditioned, and I often have to go in and turn off the air conditioning and go outside with them for a little bit just to warm up their bodies because they're super stiff, because it's cold, because we're in the air conditioning, because the same thing happens in the winter for them. We have to warm up our bodies first before they're able to move optimally for us, especially as we're getting older and we're working on that. So movement is so important. We've talked about uh why we should do it. And now we're talking about what types of movement that we're doing. I'm seeing stiffness being a problem. Um, it's it's a problem for many, especially so warm up. So I kind of want to do a little bit of movement with you all today. I can't see you, so I can't check your form, but I want you all to watch me and put down all the things that you have. If you're taking notes, there will be a recording that you can look at afterwards and you can do this again. But I just want to warm us up a little bit. So to start, I want us to bring our shoulders and we're going to sit up straight, and then we're just going to bring our shoulders back. So comes up to your ears and down. We're just warming up those shoulders. Sometimes they could feel a little grindy. Sometimes you're like, oh, that was a pop. That's different. That's okay. It's just moving. Okay. We're going to bring our shoulders up and back down so that it's moving away from your ear. As you can see, I did not do shoulders this morning and I'm a little lopsided. Now we're going to switch directions and go forward. So we're going to bring our shoulders forward and go in the opposite direction. This might be smoother than it was before. Okay. It might also be more grindy and poppy than your last one. Awesome. So from here, we're going to bring our shoulders forward and curve our back. We're just stretching out our back. Okay. Awesome. We're going to stand straight up or sit straight up. We're going to take our head and we're going to go to the side, just like this. If you want, you can take that same hand and gently pull on your head. Just feel that stretch. You're then going to circle your chin down and to the other side. And we can pull a little bit. Awesome. Circling our chin just to our chest. We're going to look down. We can pull our head forward ever so slightly to just feel that that stretch. And then we're going to come right on up. We're looking straight, and just from here, we're not going to move our shoulders. We're just going to turn our head to the side and look over our shoulder, kind of like an owl. Feel that stretch? You're going to come forward again. Hi, everyone. And we're going to look to our left. just like an owl, stretching that way. Awesome. And we're going to come forward. So that's something just to work our shoulders. A lot of us are spending time on the computer. We're spending time doing dishes, hunched over doing dishes, or gardening, any of those kinds of things that we're like hunched over like this. That just gets us to be able to sit straight up again, elongating our neck and making sure we moved. That was about 60 seconds of movement to kind of start us going as a quick stop as we're going into another movement. As I just said, exercise isn't, I talked about doing dishes. I talked about gardening. Would any of you, not one of you, considered gardening as exercise? But I'd consider gardening exercise as I'm bending over, squatting down, picking up soil, moving everything around. My entire body is moving when I'm gardening, right? So those are also mowing the lawn, leaf blowing, all of those kinds of things. We're using our full body to do those household chores that we would consider chores, but that is movement, that is exercise, that is getting our heart rate going, right? We're walking, we're moving, we're bending over, all of those kinds of things, home things like vacuuming, sweeping, mopping, all of those things, laundry, we're picking something up, we're having to do all those things. So Patty says chasing grandkids. That's exactly it. And that's another reason why we do all of these things is to keep us moving and keep us going for those people in our lives that we want to keep up with and keep going. So that's awesome. The other thing you want to think about are those hobbies that you do. So no one mentioned going golfing or playing pickleball or tennis or any number of things that are hobbies or activities that you do with friends that are also exercise. We might think that we need to go to the gym and pick up a weight or go to a class and do that as exercise, when really going and hanging out with friends, walking on the lake, going kayaking or canoeing, any of those things are also exercise. That is also movement. And those are all things that are going to benefit your brain as we're moving through everything. So just think about that as you're going through. We're staying warm, we're making sure we're stretching, we're getting our heart rate going, not just kind of strolling, but really walking. Okay. If we're walking, some of you may do a little jog. Some of you may just walk very fast. I am not a fast walker myself. So I often have to get on the elliptical to get my heart rate going for those things, which is great for your joints as well. But we want to make sure that we are staying moving, staying engaged, going and doing things, and making sure that we're not just doing the things that we've always done. Find new things to enrich your brain, learning a new pattern or learning a new activity. Those are sometimes I get the best workouts when I'm trying something new, because I'm having to also think about it a little bit too, if you're ready for that. So we have about 6 more minutes. And I want to make sure I've answered many questions that are popping up, but does anyone have any specific questions about what's going on, why you should do something? Do you have something that you've been working on that you're just unsure of? Do you want me to talk about anything that you want to know about?
You can come off mute if you'd like. I know, Jasmine, there was an observation by Margie regarding some of the specific exercises that you mentioned, along with strength training. She mentioned an excellent program called Strong Bodies. Are you familiar with that?
I'm not familiar with that personally. I've heard of bone builders, which could be very similar to that.
Yeah.
Um, I haven't heard of strong bodies specifically, but I love it. Love
Are
anything.
TheraBrands good for strength exercises? This is from Tammy.
Yes. So Tammy, I'm glad that you brought that up. So when we're talking about weights, I'm talking about resistance. I'm talking about anything that helps to build that resistance against the muscles. So TheraBands are great. Any kind of resistance bands are great. Making sure that if you want to use a weight, that's awesome too. But there are so many types of resistance bands. Many different brands, they have the small circles for your legs or your arms. They have the big circles. They have the tubes. Any of those things, and you can do a lot of exercises with those that you'd be able to do with weights in the gym as well.
So Patty Mills is asking about playing video games. She wants you to talk about that.
Yeah.
Learn about that too.
Yeah. So depends on the type of video game. So if you can get your grandkids or even yourselves to play things like the Wii or any of those active, I know Xbox now has an active gaming system that they watch you move. Um, any of those types of things, that totally works as well. So it gets you moving, it gets you to work if you are playing with your grandkids, it gets them to have fun with you. It's less strenuous on your muscles because you don't necessarily have that like chasing something around. It's coming to you specifically on the screen. The one thing that you want to make sure if you're doing those active video games is you don't have resistance that stops your muscles from moving. So if you're hitting the tennis racket, make sure that you're not just swinging and you're being intentional with your muscles and your joints. So you're not popping at your elbow or doing the same with your knees and going really, really hard when you have no resistance, because that's how you could get hurt during those activities. The same thing goes for children as well. So making sure that you're being low motion or low intensity, but a lot of motion in with that. So that could be helpful. Specific movement for strengthening upper arms. So are we talking the bingo arm area? If we're talking about that, a lot of that's going to be triceps. It's going to be your triceps. It's going to be you're going to be moving a lot of your shoulder area, strengthening this shoulder space. So triceps will be taking a weight in your hand. I'm going to use my water bottle, putting it over your head. Your elbows are going to stay in, coming down and straight up. So that's working this muscle right here. Okay. If you can't get your shoulder up in that position, you're going to come to the side like this and kick out here. And that's going to work your tricep as well. So two different ways to do tricep exercises. Your biceps are also in your upper arm. So those are just going to be your normal curls that you can do at different angles. So outward and inward, as well as your lateral raises if you can with your shoulders. A lot of us have shoulder pain. So you're going to come out like this and down with weights in your hands or a resistance band, and you're going to come up and down. And that's really going to help build up this space for strengthening your upper arms. And shoulders. So shoulders, you can do, those sides are going to be your shoulders. Front raises are going to be your shoulders, and then your upper, your press, starting with a low weight or no weight at first, and then continuing to move that. Okay. So if you have any questions, please let me know. I know we're hitting time now. Some of the questions that have come up is how we can access the recordings. So I don't know the answer to that.
Sam, can you direct us on how we might be able to access the AARP mass programs?
I'm not familiar with that, but if somebody sent me an email, I would direct it to somebody else who would know.
Great.
And then one last question for you. Thank you all for joining us. And if you email Sam, Sam, can you put your email in the text?
I'm doing it right now.
Thank you. If you have severe osteoporosis in the spine, along with lumbar, and I don't know how to pronounce that, and facet lumbar arthrosis, do you think I can go ahead in a heated pool for longer than 10 minutes, or will it be too much heat and cause muscle spasms?
So that's not a question you're going to want to ask me. That's a question you're going to want to ask your doctor, because I am not a specialty. I don't have a specialty in osteoporosis necessarily with that. So check with them and see where they would lie with that.
Well, thank you for joining us. For those of you that would like to access this specific recording, you will be emailed, because you have registered for this program, the recording to this specific program. Thank you for joining. Have a good rest of your day.